Now I would like to welcome Dr. Fernando Filgueira, a professor of social sciences at the University of the Republic of Uruguay. He will give us the keynote on using safety net at the time of COVID-19. We are very delighted to have you, Dr. Fernando, and thank you so much for joining us. And it's over to you now.
Thank you, Hanin, and thank you, Fahad and Jihad, for those introductory remarks on the challenges facing the world in terms of social cohesion and the role of trust and anti-corruption policies to do that. I will be presenting a short PowerPoint on the importance of social safety nets or basic social protection floors in the time of COVID-19, and as it relates particularly to the epidemiological strategies that countries around the world are developing, trying to contain the virus and the social disruption that it brings about. Let me first mention that as we look into the information that's coming out of the global databases regarding the evolution of the pandemic in the world, these are the countries that now are entering the top 20 positions of new cases and new deaths. Brazil, India, Peru, Chile, Mexico, Iran, Saudi Arabia, Pakistan, Bangladesh, South Africa, Indonesia, Ecuador, Chile, Egypt. The pandemic is coming to the global south. The exponential growth phase of the pandemic is coming to the global south. And the countries, when we look at the stringency index of the measures being taken by these different countries as they confront the emergence and expansion of the pandemic, shows again that some of the harshest confinement, lockdown, and social distancing measures are taking place now in the global south. Of course, this brings with it major challenges for social welfare and social well-being. Next slide. Next. Basically, we're trying to say that to avoid a humanitarian crisis and to sustain the epidemiological strategy of social distance, social assistance must reach far and fast in the global south, widely and in a longer term. Even then, some major deficits in matters of social welfare and basic infrastructure will make such strategies unsustainable for long periods of time. Still, with the immediate and still to come socioeconomic effects, a large portion of the population will fall into poverty and lose access to basic utilities and food security, unless, of course, we put in place the kind of social safety net that I'm going to try to propose to you. This requires, of course, both political will at the domestic arena, but also, very importantly, at the global level. Next slide. Basic data from the World Development Indicators of the World Bank show that low-income, lower middle-income, and upper-middle-income countries share to differing degrees traits that make them vulnerable to a humanitarian crisis under a lockdown strategy if no social mitigation takes place. High proportions of the population living in poverty or just above poverty levels, high informality with low levels of social security coverage, a large presence of the population living in slums, important percentages of the population with undernourishment, and also important groups with lack of access to basic utilities. All these data that I did gather, I did not put together in the PowerPoint. It would be too much, but basically, let me provide just one example. We can look at the graphs there and see the levels of poverty at different poverty thresholds by countries' levels of income. In low-income countries, lower middle-income countries, and upper middle-income countries. Of course, in high-income countries, that's extremely low. And furthermore, if we go down one graph, what we can see is the percentage of population with the risk of falling into poverty. That's basically a simple calculation made out of looking at the next bracket and how much of a percentage of population is in that next bracket after a given poverty threshold, between a level of income that's small enough that minor shocks might take them into poverty. Major shocks, as the ones we're living, will definitely and probably lead them to a situation of poverty. Next slide. This is an apparent trilemma and the possible and necessary solution that we believe has to be put in place. It's almost impossible to get to these three goals at the same time unless we put in place a wide and adequate social safety net, not just for the duration of the lockdowns or the immediate and harsh lockdowns that we embrace as we face the first phase of the pandemic in our countries, but also for a longer run. We cannot maximize our epidemiological strategy, be it the phase of lockdowns, be it the phase of dancing as we get contagious down, and at the same time minimize social cost and sustain a stable political environment unless we put in place these safety nets. People will develop survival strategies that require mobility if we don't provide these safety nets. We can coerce the population into confinement and make them suffer the social costs, yet this can lead to massive uprisings and social conflict. Thus, there is only one way to achieve the desirable outcome depicted by the figure on this slide, and this is a wide, inclusive, basic emergency social protection floor or social safety net. Next. I propose to you that there are at least 4 critical ingredients that have to be granted for an effective social safety net to operate. People need to have access to basic utilities, water, electricity, communication. They require a basic minimum income for food and basic needs. Alternatively, reaching the population with food programs and assets can also fulfill part of this second condition. Essential health services need to reach the population, and security, or a broader term than security maybe, secure livelihoods in communities and neighbors need to be guaranteed. Of course, we know that as the pandemic reaches the global south, already these 4 basic ingredients of a safety net are not present for a large part of the population. But we need to find innovative solutions to provide in an emergency setting these capacities to communities, or we will face not only a humanitarian crisis, but the breakdown of any effective epidemiological strategy and eventually major political unrest. Now, again, when we look at basic utilities, when we look at basic minimum income, when we look at essential health services, and when we look at security, we know there are major holes in our actual situation in most countries in the global south. And when I mention, for example, essential health services, I'm not just referring to the issue of COVID-19. As health delivery systems become overwhelmed, and as resources are concentrated to fight the pandemic, many other issues regarding healthcare are stressed and can, at different points in time, not be adequate for the populations that we need to reach. So here's again critical challenges that we have to confront. Next slide. If there are 4 ingredients for the social safety net, there are 4 parameters for those ingredients if we want an effective emergency social safety net. Those 4 parameters are those of coverage, sufficiency, timing, and time frame. We need to reach the most vulnerable population. No one should be left behind. The negative externalities of leaving people behind these basic 4 ingredients implies that, again, not only social costs will be immense, but the epidemiological strategy will not be effective. Coverage is not enough. Sufficiency, adequate basic quality levels in cash transfers, in security, in healthcare, and in basic utilities. We know already that given our proportion of population living in slums, the proportion of population with no access to drinking water, and the percentages of population in many cases with no access to electricity, this is a tall order. We also know that given our levels of today's, before the pandemic, poverty levels, this is again a tall order. Now, coverage and sufficiency are necessary, but timing and time frame in this particular context are also needed. Timing means that this should be done fast. We cannot wait for a long time to put these different ingredients in place, these different policies in place. The timing is critical because of the epidemiological strategy and because of the immediate ripple effects that lockdowns have on the economy and on social welfare. And finally, time frame. This is not something that we should put together for 1 or 2 months. This is something that we should be looking at for a longer term. I will come back to that later, but let's think that the sustainability of this strategy of a social safety net cannot be thought of as just a short-term emergency response. It has to be a fast emergency response, but built to last for a longer time. Next slide. Let me, as I start to close, move into some issues of the instruments available and an example from Latin America regarding 4 dimensions: the reach of cash transfers, social security coverage, the reach of public utilities, and the cost of extending cash transfers. I don't want you to actually look into the detail of each graph, but let me just tell you very broadly what they mean. The first one shows the emergence of cash transfers policies in Latin America and how between 1996 and 2016-17, they went from covering less than 3% of the population, 5% of the population, to almost 20-25% of the population, concentrated on the most vulnerable sectors, around 120 million people. This constitutes a major instrument that has to be expanded in coverage and extended in quality in terms of the value that we're providing, but it is there in regions and countries across the global south to be used. Secondly, the second graph shows basically coverage in terms of social security by different countries. And here we see the wide variation that we have. Bolivia or Honduras with less than 20% of employed population covered by social security, and Uruguay and Argentina to close to 70%. This, of course, gives again different instruments and capacities that countries can mobilize to provide this emergency response. The third one shows access to electricity, but it could also be showing access to drinking water or to sewage systems. And here it is important to see the deficits we have, how we can create innovative solutions to reach the peripheral areas of our urban centers and the rural areas in order that a lockdown strategy, a confinement strategy, is not a confinement strategy in conditions that are inhabitable in terms of our dwelling places. Also, let's remember that in many countries in the global south, while public utilities remain public, private enterprises are many times not delivering them, and there is a price, a tag cost attached to it. We need to guarantee that public utilities will not be cut if people are not able to pay their fees for the time being. Finally, the last graph tries to show that the fiscal effort to reach all households with children below the age of 18. To put an example, in countries like Argentina, Uruguay, Chile, Costa Rica, and Colombia, for 3 months or even for 6 months, it's not something that cannot be done in these relatively high-income countries of the global south. It's less than 1 percentage point of GDP. Actually, it's less than half a percentage point of GDP. Actually, it's less than 0.2 points of GDP in many countries. To reach them with universal coverage and to reach them with adequate quality. Of course, this is not true for other countries in which the fiscal effort should be far larger. Next slide. Let me close by showing you this last data, which is simply the GDP per capita, the average GDP per capita of countries that are characterized as low-income countries, lower middle-income countries, upper middle-income countries, and just the example of the euro area that has been going through the pandemic recently. The other graph shows you the tax revenue as a per capita revenue given GDP per capita and total revenue extraction as a percentage of GDP. And we can see the huge differences in the capacities that countries have to face this pandemic from a social perspective and to put in place these basic social safety nets. So unless we develop a system of multilateral cooperation and aid that reaches the global south, again, rapidly and adequately, many countries will not be able to put in place these social safety nets. Let me go to the last slide. And here's basically what COVID-19 has brought to the fore. It's both the impossible and unacceptable degrees of inequalities, both between nations and within nations. There is an uncertainty that weighs on us all regarding the development of the pandemic and the way in which countries will open up and do the dance between epidemiological concerns and socioeconomic concerns. This should be enough to make us understand that the emergency social safety net should move further and beyond the current predicaments. Such emergency safety net should also be seen as an opportunity to build basic and universal safety nets with adequate provision of public goods and merit goods and basic universal welfare system in the world at large. This requires that the measures that hopefully can be undertaken now will shape a blueprint for both global and domestic action in the future. Let me in close propose a concrete call for action, one that is not yet looking at the fiscal requirements, both in global terms and in national terms, that need to be developed in order to put this safety net in place. Let me just make a call for action regarding measurement instruments. We have been overwhelmed by measurement instruments of COVID cases, death, testing. We have also now have a wide array of measures of stringency closure, confinement, lockdowns. We do not have an adequate dashboard and adequate measurements of the social responses that countries are providing to their populations. Let's call on the G20 leadership to build that platform. Let's have a platform that we can compare best practices, we can look for challenges that lay ahead, we can see instruments available, and we can see how countries are responding from a social perspective to the pandemic and to the epidemiological strategy and the disruptive effects that it has on social and economic well-being of the population. That would be for me. Thank you very much.